Very quickly, learn the latest about an announcement from the Vice President, Dr. Mahmoud Baumia, that from the 1st of December, the NHIA is going to cover fully the cost of dialysis for kidney patients. We're joined by Dr. Dacosta Abuaji, CEO of the National Health Insurance Authority, to bring us up to date on this. Dr. Abuaji, what a pleasure. Good morning to you.
Good morning, Kojo. And good morning, Raymond.
Good morning.
Thank you for your time. So maybe we'll start with the brass tacks. We were made to understand that this was too heavy a cost for the NHIA to bear fully. What's changed?
Okay, thank you so much. Let me extend greetings to all Ghanaians. If you remember, around June or in June, the NHIA has actually started a pilot where 18 years and below, that's children below the ages of 18 and below, and also adults aged 60 years and above were obviously being given dialysis for free, 8 cycles for free. Then the middle age, which is 19 to 15, were being offered 2 sessions. Now, the data suggests that actually the cost can actually be accommodated by the NHIA. If you look at it carefully, the NHIA has actually grown 6-fold from 2016 till now. And looking at, going forward, it is our believe that we will be able to take on the cost of dialysis patients. But you see, we do have a comprehensive government plan for dealing with chronic diseases, including the renal disease. And the fact of the matter is that more dialysis machines are being purchased for the specialized centers in such a way that they will be able to run this for our clients at a cheaper cost. Then there is what we call the tissue organ donation and storage and transplants law, which obviously will guide dialysis, not dialysis, which will guide kidney and other organ transplantations in the country. The policy is actually ready, and the stakeholder engagements are ongoing so that it will be submitted to Cabinet and Parliament for approval. But let's look at the genesis of all these renal diseases. Most of these emanate from hypertension, diabetes. And as a government, we do have a comprehensive health promotion and prevention plan in such a way that Ghanaians are being offered the opportunity to have an annual health check of their blood pressure and also their sugar and their BMI, and all these are targeting hypertension, diabetes. So if you look at it in totality, government do have a comprehensive plan to dealing with this chronic and renal disease. So I think what the Vice President said is right, and we have taken all considerations on board, and this is what's going to happen.
Okay, now I want us to just take a moment to touch on a related. Joy News has a report coming out tomorrow of a 13-year-old girl who is on the verge of losing her life because what she needs is a kidney transplant. She has a donor, and of course we have the expertise at the University of Ghana Medical Center to perform the surgery. What this girl doesn't have is the $25,000 it will cost to save her life. In any other part of the world, we wouldn't be having this discussion, but this is Ghana, so we have to talk about it. How do we fund this? The NHIA ought to be in a position to do so. Can you help?
Let me just be blunt here and say that if you are saying that in some countries transplant is free, I don't think that is what it is in most countries. In fact, the UGMC actually do have people coming from other places coming to do majority of Ghanaians actually travel to India to do the kidney transplant. Now, like I've said, I've professed a comprehensive solution, which is prevention is better than cure approach, that going forward will reduce this incidence of renal kidney diseases. And I've told you that under the government's comprehensive policy, there is what we call the tissue organ donation and storage transportation law that needs to be passed. That needs to be cabinet need to approve for it to obviously guide the operations of this kidney and organ transplantation in the system. So I believe that we should look at it holistically than just to say that, okay, the NHIA should fund this, the NHIA should fund this. We should look at it in totality, and the solution we are professing here is the best solution for the country, and this is what's going to help Ghanaians.
Right. I mean, Dr. Boaji, with respect, what we are aiming for is universal healthcare. So I don't think
of course, yes.
we should be counting the number of countries that don't have it. Let's think about what is possible for this 13-year-old girl who is right in front of us. This case that we have right in front of us now, a girl who will die if she doesn't get help.
Well, the NHIS has not conducted any actuarials on kidney transplantation to be able to absorb kidney transplants. So as I sit here, I'll not be able to give you an answer to whether we can do kidney transplantation. The fact of the matter is, you see, like I've said, let's look at it in totality, because isolating it could cause problems. And I cannot commit government to something that has not actually been costed. Now, there's even no law. The policy to guide it is now being discussed. And the policy is ready, and it's going through stakeholder consultation. So to jump to the conclusion of it will be very dangerous for me to pronounce. Maybe on a personal level, maybe I have to do some contribution, no problem. But I cannot commit government to something that has not been costed for the whole country.
Well, that's all well and good, Dr. Abuaji, but we still have to intervene where we can. Now, I want to know what the NHIA is able to do. I know you have contingency budgets for all kinds of things. I know that some of your money is even sent to fund peripheral healthcare service, like the ambulance service and so forth. So I want to know what is possible in this unique situation. I'm not asking you to suddenly create a new policy while you're on the phone with us. What I'm asking is to know what is available, what is possible in terms of contingency to help with a unique situation that has come to our attention that we cannot ignore. I know that as a doctor you feel compassion for this young girl. So, Doc, I want to know what is possible out of all the taxes that we have paid to keep this service running. What is possible?
Thank you so much. You see, there's one thing I'll have to let you know from the NHIA. You see, you cannot actually spend monies that have not been given to you. You cannot. What you cannot do is to spend monies that have not been approved for you. So under the NHIS, there's what we call the core and the non-core. The non-core is the 10%. That is what comes from the ministry. Our core duty is the claims. Now, from what you are asking, it will even need the board approval and everything. So we may have to take it off air, then discuss it in details, what it is, and I can present it to the board. If the board thinks that we have to fund this, no problem. But because this is we are almost at the end of the year. So the opportunity here is also that we'll be going to Parliament very soon. So maybe if it's something that we have to consider, yes, we can present it to the board and see if the board can obviously support such patients. So that we can obviously ask Parliament to do something. But at the end stage of, the key point is that we want to deal with, we have a comprehensive plan for chronic renal disease. And this comprehensive plan include free dialysis for our clients.
Dr. Abuaji, we hear you loud and clear on that. We think it's a welcome policy. But before we let you go, I'm going to ask you, because you have suggested a way forward, which is to bring it up with the board and see what is possible. I will ask for a personal commitment to do this for this particular young girl, to please bring it up with the board and find out what can be done. Before we go and ask anyone to shell out $25,000 more to save one more Ghanaian life, let us see what we can do collectively from the money we have already collected. Please, I am asking for a personal commitment from you as the boss of the NHIA to bring this up with the board and find out what can be done for her. Can you give us that?
Okay, Kojo, thank you. So, like I said, I would definitely submit it to the board at our next board meeting, and we will look at what comes up. Like I said, there's a window of opportunity because we'll be going to Parliament very soon for our budget to be approved. So definitely, we are currently doing our budget, and I believe that once the board gives go ahead, then we will know what we can do.
Thank you. You're a good man. I appreciate that. Now let's conclude on the proposed plans. You've costed this. Is this something that we can do with comfort going forward? Bearing in mind that your funds are capped by law, and so you don't get all the money that we pay in taxes or in levies coming to you. Are you able to sustain the continued treatment of dialysis patients indefinitely?
Kojo, thank you so much. I think so. If you look at the plan for the vice president, and I'm going to lay something bare to you. You see, he's really optimistic that he will be able to commit more funds to the NHIA. And what from his plan and what is in the manifesto of the MPP, you can see that there is a flat tax, and the levies, instead of going to the consolidated account, will be amended. And this is a proposal that I've been championing for a very long time. So the levies will directly come to us. So basically, the capping is gone. See,
so really?
With this we'll get more money and even add on more. But let me also say that, you see, like I said, I gave you about 4 points agenda for the government comprehensive plan. 1, you have to support the system with more dialysis machines. He's saying that this agenda 111, the agenda 111 will have some centers that will have these machines, so that patients will not have to always travel to Kolebu or Komfanoche, but the centers will be closer to them.
Right. If this is based on, if this requires,
wait.
Go ahead.
This, as we last month, the nephrology department at the new one, government actually gave Kolebu more dialysis machines there. As we speak, World Bank, through the NHIS, is giving more dialysis machines to some facilities that have actually applied to us that they needed help. It is currently with PPA, the procurement. And again, you know, when we went to Parliament, we were giving some funds to obviously take care of dialysis. Look, the estimated numbers are way below expectation. In fact, we were even thinking that we'll be overwhelmed. But the strategy was to give the facilities a global budget so that they feed back to us under the pilot. As we speak, the facilities are still holding on to the funds. The actual numbers do not reflect the initial numbers that were given to us. So this gives us every confidence that we will be able to support the dialysis patients without any cost of alarm for the NHIA.
Right. You mentioned that some of the delivery of this policy will depend on some centers being set up through Agenda 1.
Okay, so what I said was that at the moment, dialysis is a specialized. This is not all facilities that can do it. It's not all fast. So patients have to travel to the centers that can do it, which is Kolebu, Komfo-Anokye, 37, Whole Teaching Hospital, and all those things. It's bringing discomfort to people. So whilst we look at this to support Ghanaians, there's a next level to it. The next level is that let's bring some of these centers closer to the people. And this is what I'm saying, that the Vice President is really encouraged that the Agenda 111 will have some, which is every district. Some of those districts will have these renal units equipped with dialysis machines to serve populations in such localities. So I think it is forward thinking, and these are bold solutions for the future.
Okay, so this is not something that is to be implemented from the 1st of December. This is for the future.
No. We are implementing. So, okay, the pilot has actually ended. So we are now bringing it permanently on the NHIA. So it's starting on the 1st of December. But we are looking at expanding it in such a way that people will not be crowded at Komfo-Anokye or Kolebu or the other places.
But from the 1st of December, people will be crowded at Komfo-Anokye and Kolebu and those places, because we obviously won't have Agenda 111 in place.
But the pilot has been successful, and I've given you the numbers. Now, as we speak, the NHIS do have the numbers. Those on dialysis, we know them.
Yes.
It's something that we have obviously thought through carefully, because we do know those on dialysis now as we speak. And I've told you that even the initial numbers that we were even expecting, it's even way low. The money is still there. They were given only 3 million. We've not even able to spend even half of the 3 million.
Okay.
So it definitely means that we can obviously support these patients. But do you get the scenario that I'm putting across?
I understand what you're saying. What I'm clarifying is what will happen from the 1st of December. From the 1st of December,
what will happen?
Agenda 111 will not be in place. So the implementation of this will be.
But you are confusing the things. Okay, let's take it stepwise. You are confusing the things.
I don't think I am.
Government started a pilot. No, wait. Government started a pilot. The pilot was for 18 years and below, 60 years and above, and in between. We have looked at the numbers, and we are saying that for those people or Ghanaians who were benefiting from the pilot will now get it for free. We are now obviously expanding it, but you have to also think of the future, because people have to travel from, let's say, Agogo Hospital, Agogo to Komfo-Anokye, from very far places to Kolebu. It is the vision of government to reduce the cost of the travel cost to an associated cost for patients. So we are saying that going forward, the Agenda 111 hospitals will also have dialysis machines to serve the various localities. So it's in two folds. First, we are adding it on 1st of December because we know the patients already benefiting from this dialysis program that we're doing. But we are also expanding to bring more comfort to these patients.
Which means that from the 1st of December, the service will be available through the existing centers. But in the future, when Agenda 111, but in the future, if Agenda 111 is implemented, then there will be more centers.
There will be more centers.
Then I'm not confused, Dr. Abuaji. That's what I said. Now let's get some numbers down. How many dialysis patients does the NHIA expect to start serving from the 1st of December?
Okay, so thank you so much. So the numbers that were given to us by the association initially were around 600. But actually, the actual numbers that we are serving currently is about 400.
About 400 across the country.
Yes, that's the numbers that we are serving now under the pilots.
Okay.
Yes.
Under the pilot. But from the 1st of December, How many do you expect to serve?
You see, the fact of the matter is that they have an association. They have given us their numbers. I cannot challenge their numbers, and it has even been, we have even established that the numbers they even gave us were way below what was the actual.
Mm-hmm.
Yes.
So what is the actual?
It is open to all Ghanaians, Kojo.
So what
we are saying that we'll be able to fund all Ghanaians who need dialysis.
Yeah. So what number did you plan with? Obviously, you've planned for this. So what number have you planned with?
Kojo, the point is, do you know that even under the pilot, we gave room to add more? And anybody, patients who were not even initially captured, because when we beginning of it, we even had the numbers, we had their names attached to it, but we keep on adding. Bear in mind, this is a specialized disease, and the end stage is not, the numbers are not as obviously, it's not like every Ghanaian is on dialysis. You get what I mean? So let's take it stepwise. We as NHIA, the numbers we were working with initially were 600, okay? And currently the actual reflects about 400. And we've been able to provide this service for all the patients without any cost of alarm. The good thing is that from 1st of December, we will continue to provide this service for them for free.
Dr.
So
Boaji,
permanently we are adding on.
Okay, Dr. Boaji, the Vice President has announced, an intervention to start from the 1st of December.
Of course, it's not different from what I'm telling you.
This intervention will cost money. In order for our listeners to feel confident that this is something that has been planned and thought through and will be implemented, I think you need to be able to communicate to them what numbers you planned with. So that's what I'm asking you, that from the 1st of December,
I have the actual numbers of people on dialysis. Okay?
Yes.
You do not have it. I have the actual numbers of people on dialysis.
And I'm asking you for that number.
And I've told you that currently, the numbers stand at about 400 of Ghanaians who are on dialysis on the NHIA.
Across the country, 400 of them.
Yes. That's what I have now.
That's what you have.
And I'm saying that even if it should go up, it will not cause any problems for us, because as we go along, more people will obviously also be willing to enjoy the service. And we'll ask hospitals or facilities to cover these patients.
Understood. So the number you have is 400 currently.
Yes.
Okay. How many sessions per week are you going to be able
to? The 8 sessions, the same 8 sessions that we are providing.
8 sessions per month.
Yes.
8 sessions per month. Okay.
Yes.
So how and that's about an estimated cost of about 600 cedis per session. Is that still correct, or has that changed?
I think we only worked with approved prices from Parliament.
Right.
And I think, if my memory serves me right, it was around 400 and something from what was approved by Parliament.
Just over 400
so
cedis.
let's also get that right.
Okay.
That, you see, the thing is, yes, people may have their own cost and other things, but we can only work with the approved figures from Parliament.
Right. Okay. So that would be something like about 4,800 cedis per person per month.
Yes.
Okay, for 400 people by your estimation, and it could be more, as you've anticipated. Okay.
Yes.
All right.
And like I'm saying, if you look at the pilot figures, that was it. But even if it's double that, it's still fine. Could you see? Let's look at something. Let me assure Ghanaians that the NHIS is at its best over our 20-year history. In terms of funding, in terms of everything. In 2016, our budget was 1.2. Today, our budget is 6.8 million, a billion. You see, which is again within capping. Okay, so for example, if it's within capping, and if you uncap, definitely you add about 20% more of these funds to it.
Right.
So there shouldn't be any cause of alarm. And even if the numbers, let's give an estimated number of about, if we budget for about 1,000 of the patients, from what I've told you, it is easy to cover.
Right. Okay,
Yes.
just before you leave, I've got one message coming through from a listener, Angela, who says, "Good morning, Kojo and Raymond. Kindly ask your guest if he's suggesting that there aren't solutions currently in place to assist the 13-year-old girl." I know we've talked about this, but just to answer our listener.
I haven't said that there is no solution to support this young girl. I haven't said so. I'm professing a solution that, as a spending officer for the National Health Insurance Authority, I have to get approval from my board, and I have to do consultation.
Committed to doing that. We appreciate that. Now you keep talking about the association when you are estimating the numbers. Have you accounted for those who are not part of the association?
Yes. So that's what I'm saying, that you see, we know that because we're going to provide it for free, the numbers will surge. So even if you do twice that, we will be able to still cover. So for example, they gave us an estimation of 600. Okay, that's what the association gave us, 600. Twice that is about 1,200. If you look at it carefully and you cost it by the 400, as I have said, we will still be able to cover for people. So we've made that room also for the other people. But the fact of the matter is that, you see, I mean, bear in mind, like I keep saying, these are specialized things that are being done in specialized hospitals. Okay, it needs to be assessed to make sure that, okay, yeah, really, you do need the dialysis. You do need it. So it's not like, okay, patients will also rush there to say we need dialysis. It is on the doctor's recommendation. And I've told you that since the pilot, we have been accommodating new cases. So it shouldn't be a problem at all. And I must be clear that we are clear in our minds. We are clear by the data that we will be able to support dialysis patients.
All right. Now, a couple more messages here. This one says, "Please tell Dr. Abuaje, the president of Ophthalmological Society of Ghana, says the policy for the legislation for organ and tissue transplant is not available. Ministry of Health must work on pushing this agenda so that people on dialysis who are literally buying time for kidney transplant later."
Yes.
Yeah. So, yeah, just pointing out that the policy...
He's right. That's what I said. The policy is ready, but we're doing the stakeholder consultations to make sure that we submit it to cabinet. Then later, we believe that it will go to parliament for approval.
All right. I want to thank you very much for your time with us this morning. Dr. Abuaje da Costa is the CEO of the National Health Insurance Authority, and he has made a personal commitment to us that he's going to bring up with the board options for finding funding for this 13-year-old girl whose story has come to our attention, who needs a transplant in order to survive. We will certainly follow up with you on that, Dr. Da Costa Abuaje. We appreciate your time with us.
Thank you so much. Thank you.